And we have a 35...
It is another normal day in the life of a veterinary doctor, Gabriel Ouma, and he is here to see his patients, ranging from cats to dogs, and even home visits to those with horses and birds. Fluffy just got here after she was referred from another vet clinic. She is said to be restless and purring heavily throughout the day. Dr. Gabriel Ouma has received him, and after a series of checkups and X-ray, Fluffy was found to have an open wound that was causing her pain.
You can fix it. There was a tract, an unhealing tract, and we had to repair that tract. On the X-ray, we didn't find any problem.
She was put under anesthesia to numb the wound, as well as make her immobile during the surgical process. Carefully and strategically, Dr. Ouma removes the dead tissue around the wound before stitching it back. This is to ensure that Fluffy does not undergo another surgery to remove the dead tissues.
It will be another story.
After about 30 minutes, Ouma is done with the process and Fluffy is as good as new. Still under anesthesia, she's taken to the ward where she will undergo observation as she recuperates.
Toti.
No sooner were we through with Fluffy than Toti arrived. An 8-year-old Shih Tzu dog breed that has a lump on her third teeth off the left breast.
Blood accumulating. And this one normally, in most cases, it's normally a mammary tumor. It can also be a mammary cancer. And such conditions, we are going to perform a surgery in 2 days. And we are going to send the sample to the lab, and the lab will tell us.
Gabriel Ouma, a trained veterinary surgeon, has been running small 5-vet clinic for almost 8 years now. According to him, there are various zoonotic diseases that could be spread to humans if the animals are not vaccinated. Rabies is one such disease that kills within 24 hours if a patient is not treated.
Most are transmitted by external parasites. We are talking of fleas and ticks, mosquitoes sometimes. Then others are caused by internal parasites. We are talking of all types of worms. And the third and most common cause of diseases is food.
Working with animals seems enjoyable to him, and Ouma even knows how to communicate with them. Polly is a 3.5-year-old and has been Dr. Ouma's client since she was a puppy. She has a fungal skin infection and is here to be vaccinated. After that, she'll have a serious health bath. So what sparked Dr. Ouma into this career?
So I found out that I loved feeding these animals, attending to them, cleaning their areas. And then at around 9 years, something sparked up. Normally, they could tie a hen on its legs. And then in the evening when you come back from school, it's slaughtered. And I will cry and I will get furious and I will refuse to eat the meat.
Many people care less about animals and will pass any ailing stray dog or even not bother about them in the streets.
It's good if you're keeping a pet and you're not keeping it for breeding and selling purposes. You see your vet so that it is fixed, so that it cannot give birth. It also gives the animal, helps the animal to be calm at home and doesn't run away.
And what advice does Dr. Ouma have for youth who would want to be veterinarians?
Get a mentor. Mentorship is the most important thing. And during your holidays and free time, visit your mentor or the place that they work. Learn to see what they are doing and maybe just to develop the interest.
It has been a long day for him and definitely fulfilling as he has managed to relieve the pain of suffering animals. Diana Rose, switchTV.